What is going on, guys? This is Bill. And if you've seen me in person at a birthday party or a reptile show, maybe a reptile expo, or you've seen me on YouTube, you've seen some clips of me on other channels, you have likely met Ralphie. Ralphie is an Argentine red Tegu. He was surrendered to Badgerland a couple years ago, and since then he has become an incredible ambassador for reptile education. He's got such a sweet heart, he's got such a sweet demeanor, and he is amazing. Tegus come from South America. They are found in South America. There are black and white ones and red ones. They are the same genus but different species. Those names will be here. But today we're going to take Ralphie to the vet. So when I first adopted Ralphie, he came to us very obese. He was overweight and he was fed an improper diet. Reptile diet is very important to me, and obesity in reptiles is something that I pay really close attention to. And I think our perception in the hobby has kind of gotten a little slanted, where animals that are obese we think look healthy and animals that are healthy we think look skinny. However, Ralphie has lost weight. I've put him on a diet, and he's getting a lot more whole prey. He's getting a lot more appropriate food. So I do want to make sure that he's healthy, and so we are taking a vet visit today. We are going to go we're going to give him a health check. We're going to make sure that he's healthy. Again, I know I put him on a diet to lose some weight, and I'm worried he might have lost a little too much weight, being full transparency with you guys. And so I don't know if he's too skinny now and needs to bulk up, or if he just has some loose skin from his weight loss journey. So let's go to the vet, let's pack him up, and let's take a trip to the vet and find out.
Fill out that bottom yellow version for me.
Okay, sounds good. Thank you so much. Ralphie's roughly 6. He came to Badgerland, I want to say about 1.5 or 2 years ago. I can go through and find pictures when we first got him, but he was obese. He was pretty filled out all around. And his previous owner fed him a lot of ground beef.
Okay.
I think that's where some of that came from. I'm not a hater on ground beef. I know some keepers use it, but it's pretty high in cholesterol. I don't think he got a lot of whole prey.
I always ask people when they supplement, especially like multivitamins, when you do it, is it a pretty heavy supplementation, or is it like more of a kind of light sprinkle?
It's a little heavier.
Yeah.
It's only in the meatball. So a lot of his diet is whole prey. He's getting most of the stuff from whole prey.
Okay.
But that once a week when I make that meatball, I'm adding Repashy calcium, Repashy vitamin A, and a Reptivite vitamin and mineral supplement. Sometimes the Repashy alone has all the stuff in it.
Yeah. The reason I ask is just there's the few vitamins that are fat soluble that you can over supplement.
Okay.
Vitamin A, D, E, and K.
Yeah, okay.
And so for those, I usually do once or twice a month.
Okay.
If you're doing a heavier supplementation, or if you're doing weekly, you can, just because it's easier to remember, you can do a lighter supplementation with those specifically. But
right on.
But the water soluble ones, so the rest of them and the minerals and everything, generally they don't. It's harder to over supplement with those because they can just be urinated out. Versus the fat soluble ones, they can be stored in fat and they can get too much of it. So
that's really good to know.
Yeah. Come here and take a look at everything. Nose looks great on this side. His eyes, his ears, and his nose look great. See if he'll look out for me.
He usually does.
Assess his tongue a little bit. We'll wait on it since he's chilling out right now. His tongue looks great. There's no mucus buildup. It's really symmetrical, nice and pink. But yeah, all right. So overall, he does have a good bit of muscle and fat, kind of on his base of his tail here. He does maybe have a little bit of scoliosis kind of in the base of his tail here, probably if he was getting fed mostly meatball. You can see it's not quite straight right there. Maybe a little bit of metabolic bone disease when he was younger kind of thing. But again, it looks like he's recovered really well for the most part. Yeah, so I agree with you though. I think his body condition is a little bit lean.
It's a little lean, yes.
Under condition, so we graded out of 9, 5 being perfect. He's a little lean, maybe a 4.
Okay.
Out of 9. heart rate's about 50 beats per minute. His breath rate's almost the same, actually, about 50 breaths per minute. I think just because he's a little bit, excited from the breathing, but that sounds great. He's got some big sharp teeth in the front there. Good job, buddy. Yeah, so the roof of his mouth, their coena, it's called, looks great. It's kind of where their nose connects to their mouth. I'm trying to look at his glottis, looks clear. His teeth are actually...
You got little snippets of vision there.
Oh, yeah.
little sites.
Everything is in just little quarter seconds snaps with these guys sometimes, but he has a tiny bit of an underbite. I feel like
he does.
The Tegus get that pretty often, but good job, buddy. Yeah, so his teeth look great. Those front ones are real sharp and the back ones are more molary too. So
yeah,
but roof of his mouth looks great. No signs of inflammation or infection or discharge or anything. All those teeth are healthy. Gums look good. No crusting, nothing like that. So definitely, I think let's check his organs out, check his blood cells. And today we can get his blood sample.
Yeah.
Send it off. I think if the blood work looks perfect and maybe you're like, oh, he's not eating more, his weight's not, is not stable, maybe even going down, then for sure I'd say we can get an x-ray as, just as the next step. But today I think because he's still doing great, I think it's all right to do the blood.
Awesome.
And maybe drop that stool off whenever you can.
I can drop that stool off as soon as I can get one.
Yeah, for sure.
Ready, bud?
But yeah, he looks great though. On
Okay,
exam.
good. I'm glad to hear that. That's awesome.
Awesome. That is really good news. I'm really happy that even though he's kind of looking superficially a little thin, he might be a little bit underweight. It's not extreme. We got a clean bill of health so far. We're going to get a blood test done. I'll get those results in a couple days, and then we'll see how he's going. I also wanted to point out that when I was in the waiting room checking in, I had a hard time kind of filming some of that stuff. But Ralphie is the first reptile here at the clinic, which is really cool. So congratulations, Ralphie.
Okay, so I got a voicemail from Dr. Barajas. Let's take a listen to that and see what's going on. This should be the results from Ralphie's blood test.
Hey Bill, this is Dr. Barajas at Mayfair. I'm here calling you about Ralphie. Just wanted to let you know that overall the labs look normal, except his uric acid is moderately elevated. So the uric acid, we worry about kidneys, potentially gout, that kind of thing. So I do think the next step is to get some imaging. If we can get you back in to get some x-rays, maybe ultrasound if we can do it. Sometimes it's hard with their scales, but I am heading out of the office here in a little bit, but either way, just let you know.
Okay, so his uric acid was high, which could be dehydration. It's always weird to me that animals that have water bowls, access to water all the time, get misted regularly, could have dehydration, but I guess that happens sometimes. That's why I usually soak our animals on top of all the other stuff that I do. But because Ralphie was obese, there could be gout, there could be some liver damage based on his previous diet. So I'm going to make an appointment to bring Ralphie back in, and then we can see what's going on. Okay, guys, so we got that voicemail that Ralphie showed like a higher level of uric acid, which could potentially mean gout, could potentially be some lasting side effects from his previous diet. And so we are running back to the vet to have some blood work done, and we'll go from there. So we're going to see what happens now.
So that's good. So the next recommendation, because the uric acid was high, is to get some x-rays of his body.
Okay.
I want to check out specifically his kidneys, his joints. Make sure there's no signs of gout, make sure there's no signs of like mineralization of his kidneys.
Okay.
We got the x-rays back. We got the x-rays taken. We are just waiting for the results to come back, and Ralphie and I are still just chilling. What are you doing?
So potentially I'm worried that he does have a systemic illness that's making him lose that weight, making him not want to eat as much.
Okay.
He has great bone density. So now, obviously you've been supplementing him. His lighting is good and everything. So skull and teeth look great up here. But technically this should be his radius here. It shouldn't have that sharp turn in it. It should be straight like the ulna. But you can see on both of them, these are slightly different positioning, so this isn't more severe.
But why is his bone doing that? That's really weird.
I suspect maybe at a young age he had some
nutritional deficiencies when he was young. Okay.
Yeah.
That is wild looking.
So there's a really like contrasted difference here. So the lungs are dark like they're supposed to be, but I worry that he might have signs of fluid building up in his belly. And there's several things that could cause that, but one thing I'm noticing is I don't see signs of
You're not seeing gout.
gout, yeah. Like really spaced out joints anywhere.
Okay.
They can have visceral gout, or gout that is not in joints, but gout that's in their body cavity.
Okay.
So that's still a possibility. Bill's also pretty severely kinked there, which we
Yeah,
kind of knew
we talked
already,
about that before.
But I wonder whether this was a fracture, so a break, or it just developed incorrectly from the same reason. And similarly with the radius bones on both forelimbs, because the uric acid was so high. Is he dehydrated? That's something that would be like a pre-renal issue.
Okay.
So the kidneys just aren't getting enough hydration. Does he have an infection? That would be, again, the simplest and easiest. It's not often what actually is going on. And his white blood cells were all normal, so I'm less suspicious of a kidney infection.
Okay.
One thing that I discussed briefly with you too is that it's possible to over supplement too. So his uric acid levels were off the range.
Yeah.
So severely elevated. I think.
Which could just be dehydration
Yeah.
again.
Yeah. So one thing I think I might take a break on the supplementation.
Okay.
Only because it's really hard to test if their vitamin D levels are high. I might take a month just on the vitamins and minerals.
Okay.
Just because that is something that sometimes we can overdo. And is definitely I recommend soaking daily.
I'll try and get a stool sample to you as quick as I can. I'm going to keep him soaked daily. I'm going to keep feeding him the regimen he's on. I won't do the supplements for about a month. We're home from our vet appointment. We're eating a little sloppy here. We're getting a little bit of a mixed bag today. We got some fruits and veggies, some turkey. We did not add the supplements to it. We are going to take the advice from the vet, and we're going to let him rest. We're going to give him a break from doing shows for a couple weeks and see how he does. We're going to do the daily soaks. We're going to refrain from supplementation, and we're going to see if it has any impact on him. And I'm going to schedule a follow-up vet appointment and do a CT scan to see if we can have a deeper look at some of the stuff going on with him. So I'm not food. Your food's in the bowl, buddy. We love you, bud.